More and more patients are coming to our center with large amounts of supplements, various vitamins, minerals, herbs, potions, commotions. The question is, do these things really work? Perhaps they do. Stay tuned and find out. So, supplements. Patients often ask about supplements. Doctor, are there any supplements I can take? There's some natural ways of healing my ailments. But the first question is, what are supplements? We have this generic term of supplements, and there's a broad spectrum of chemicals and artificial things that come under the label of supplements. One classification are artificial chemicals that are extracted from nature. We'll go into the lab, we'll look at vitamin C or certain mineral, and a scientist will recreate that in a laboratory. These are artificially manufactured chemicals. Other supplements are true extracts from plants. They may be chemically extracted, they may be more naturally extracted. Some are naturally occurring food substances, so you may get a plant, freeze dry it, put it in a powder or capsule. That could be another form of a supplement. And there are other supplements that are a combination of the above. So supplements come in this broad classification of nutrients, and I like to refer to them as micronutrients that we use to enhance our diet. And based on how they're made and how they're formulated, may determine how effective they are. So the second question about supplements or micronutrients is, why might they be necessary? What about our food? Well, in essence, we've come to know that our food supplies have deficiencies in nutrients for various reasons. Our soils have become depleted due to commercial farming. Nutrients are shipped from far away. They may be harvested before they're ripened, and they be frozen. Other kind of chemical changes happen to our foods. And so our foods have been chemically altered, the way they're raised, as far as animals are concerned, the way they're cultivated, they're depleted in nutrients, and this has been shown scientifically. The other reason we may need supplements or micronutrients is because we have poor dietary habits. Most of the foods we consume are junk food. No one has time to cook at home, so we're eating at fast food restaurants. These foods are processed, these foods are over-chemicalized, and they are nutrient deficient. Also, due to our health conditions, many individuals have an abnormal GI microbiome. Many individuals have inflammation of the GI system, and so we're not really absorbing our food very well. And various other chronic illnesses impede our ability to absorb our nutrients. Supplements or micronutrients could be helpful to enhance our vitamin and mineral intake by giving high concentrations of these vitamins and nutrients in other forms. So the next question about supplements or micronutrients is, are they helpful or harmful? Well, that's a great question because we really don't know. There are not a lot of large-scale studies showing the overall benefit of individuals who take micronutrients and supplements versus those who do not. That's one issue. The other issue is these supplements are not regulated. Many over-the-counter supplements consist of many cheap chemical fillers, and they're useless at best, and they also may be harmful. There are also other supplements that can cause significant harm because they can have adverse reactions in the body. These chemical fillers can cause allergic reactions. They can cause adverse reactions with the liver, and they can have an adverse reaction with medication that you're already taking. So how you select the supplement and how these supplements are manufactured is really important in terms of their potential benefit and harm. With all of that information, how should we use supplements? Should we use them or not use them? What should be our approach? It's really simple. First and foremost, you should work with a healthcare professional who's knowledgeable in using supplements and micronutrients. This person has gained a lot of experience, not only based on their study and training, but they've gained lots of clinical experience working with patients. They've gained insight in terms of how to use these supplements and how beneficial they are, and what circumstances to use them and what circumstances they're not beneficial. You should also have a complete medical evaluation, including extensive blood work. The use of supplements should be targeted based on their need. They shouldn't be randomly taken or given, if you will. Just because vitamin C is good for you, you shouldn't just take vitamin C. There should be a need for it. Your clinical healthcare professional usually has access to supplements and micronutrients that are not available to the general community. And lastly, these micronutrients should be used in the context of a healthy lifestyle. So while you're using supplements and micronutrients, you should be improving your diet, you should be improving your sleep, you should be improving your hydration. You should also be exercising. Supplements are meant to be supplemental to an optimal lifestyle. I'd like to share a clinical example of how we use micronutrients in our center with a particular patient that we saw not too long ago. This is a 40-year-old lady who presented to our office. She had a history of many chronic illnesses. She had symptoms of resting tremors requiring medications. She had asthma attacks. She was having shortness of breath. She had the inability to lose weight. So what was our approach? As usual, we started her on a nutritional detox regimen. However, she was not able to tolerate this for various reasons. For some reason, she would start to detox. She had lots of detox reactions. She would get sick. But despite our efforts, she didn't tolerate a nutritional detox. She had been seeing other specialists prior to seeing us, and she was on various medications. We tried to make medication adjustments, and that was unsuccessful. So on one of the follow-up visits, we ordered a special micronutrient blood test. This test was sent off to a special lab, and the way this test is run, they look at intracellular nutritional components. So for example, in the blood, they'll take white blood cells, red blood cells, and they'll break up the blood cells, and they'll measure the nutrients within the cells. Regular blood tests look at the nutrients and chemicals in the plasma. This is the liquid around the cells. But many of the nutrients and the measurement of the nutrients inside the cells is more important. So this special micronutrient test was used, and we got a lot of valuable information because the test results were as follows. When we looked at her test results, we saw some very interesting things. She had lots of borderline micronutrient deficiencies as well as severe nutritional deficiencies across all types of nutrients. Now, it would be very difficult to give someone a capsule for each of these nutritional deficiencies. She'd be taking pills all day long. However, we have a special micronutrient lab that we work with that can formulate a customized micronutrient supplement for her. It's in a powdered form, so in 1 or 2 scoops of a powder, she'll get all of the nutrients that she's deficient in that's specialized for her deficiency. She can add this to juice or water and take this on a regular basis. Additionally, for someone with a diffuse amount of micronutrient deficiency, we'll also have a gut cleansing protocol as well as a probiotic regimen, because she likely has some amount of dysbiosis resulting in inflammation and resulting in malabsorption. So we did exactly that with this patient, and here's what we found. So 3 months after she had been on this special micronutrient formulation, her tremor was nearly gone. She was sleeping better, and she lost 20 pounds. She was able to tolerate the nutritional detox without getting sick, and we were able to wean her off most of her medications. So in essence, many of the problems that she had related to her chronic illnesses, and to some extent her ability to detox, was related to her biochemical imbalance. And by looking at micronutrient deficiencies, we were able to use supplements, or as I call them, micronutrients, in a targeted fashion to help her body get into biochemical balance. In this situation, the micronutrients played a valuable role in allowing her to detox properly, and allowing her to heal her body, and allowing her to lose weight and achieve optimal health. So what should your next step be? First of all, seek out a professional with expertise in this area. Next, get your medical evaluation started as soon as possible. And of course, feel free to contact us for help. See the link below in terms of how you can get in touch with us. I hope this information was very helpful to you. And until the next video, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.